What I think is interesting about Dihexa is it tends to wear off pretty quickly. A couple patients I have on it that are doing well are continuing to take it. And if they miss it, for example, TaylorMade occasionally can't get, the batch isn't safe enough, so they scrap it and they have to do another one. And so they'll not be able to get it to the patient in time. And so they'll miss a couple of days. They notice a big drop off in symptom improvement when they stop taking it. And so they'll notice. So this is a patient of my nurse practitioner, actually. So they told the family to stop using it for a few days to see if the symptoms, if it gets worse, because then you'll know, is the drug the cause of the irritability, or is the irritability because he's more cognizant?
Yeah. He may just be angry because old dudes get angry. We all do. We don't want to die. We're pissed off. Like, how's anyone?
You want to be able to take care of your family. I mean, that you want to be able to provide for your family. And so if you're that age and you realize that you have this big stroke thing that happened, it was a traumatic brain injury, but that happened, you want, the first thing he does is go to look at his finances so he can be sure he has the ability to continue to take care of his family. Sure. And now his first concern is, can I still do that? And so that's what's happened.
Do you use any non-peptides? Like when my mom had a stroke, I gave her creatine monohydrate every single day because I had found a really good study that showed it helped resolve stroke faster. Anything else you use?
I use ketones.
Yeah.
And I really try to get them to stop using sugar.
Yes, because here's the interesting thing about ketones, right? Glucose is everything we put in our body has a level of toxicity. Everything we eat. And sugar tends to be the most inflammatory of all the things we can eat. But ketones are not. And so by getting their brain to use ketones instead of sugar, you have a lot less friction. Let's call it friction in the brain. And they become more cognizant, they become more alert, and they feel better, and mood changes and everything. I think that's brilliant. I didn't think of that. That's a great one. And
of course, the simple thing you can do is Alka-Seltzer Gold twice a day before meals. It's the change in pH from alkaline to acid, stimulates the vagus nerve and causes those inflammatory macrophages, the M2 macrophages, to convert into that very calm janitor cleanup type.
Interesting.